Time to cut them off like me. I know how to make a drop off easy. When you treat her like your number one baby.
Wanted to go viral. Helen.
Naomi. We just wanted to get the word out and also like kind of build morale. It helps when people do something team building, connective, move our body in some way.
Especially because we're therapists.
Yeah, exactly.
Yeah.
So Helen was like, do you want to be on TikTok? And I was like, do a dance? And she was like, no, but then
Good
we just
idea.
learned one.
Sounds like healthcare. It feels good.
Exactly.
Build on top of each other.
And then we taught everybody was down, so it was fun.
Awesome.
I'm Anessa Larson. I'm a psychologist at the Department of Psychiatry in Vallejo.
Why are there suicides at Kaiser?
One of the biggest problems that we have is access to care. So while there's so many patients that need care and need the support that are in crisis, they're languishing out in just waiting for just even a first touch by a real clinician, not somebody who is just, trying to take in their information, because we can do that. We do that within a couple of days, actually. But then they don't see a patient, they don't see a therapist for sometimes up to 8 weeks. And in that time, people are going into crisis. And in that time, so many people are feeling like they have no other choices but to suicide or to hurt themselves. So this is imperative that we change the system, that we shake this up, and we tell people we can't do this anymore. It's unethical. It's immoral.
It sounds like criminal negligence because Kaiser promises health care, don't they? Mental health care.
Absolutely. I agree with that. And that's why I think that coming out here and getting loud about it and striking and saying we can't do this anymore is incredibly important. People are actually hurting themselves as a result of not being able to see a doctor or a mental health clinician. It's unethical.
Previous strikes, there have been family members of people who've lost their loved ones because they weren't getting treatment in a timely fashion. It sounds like it's the same old story.
There hasn't been any changes, and in fact it's gotten worse, as so many of my colleagues have felt that they can no longer provide services that are within best practices even at Kaiser, so they're leaving. So the therapists that are left are holding way more patients than any clinician can, and so the people are absolutely at this point not able to see patients at even longer times. So it's really challenging. The pandemic made an already broken system even worse, and then here we are today. There's been no changes. We're out of contract. Kaiser won't come to the middle. They won't come to understand what it means to be a mental health clinician today in this huge Kaiser system. I want Kaiser to be able to provide the best care possible. I think it's possible. I think they can do it. They just really have to listen to the boots on the ground, the therapists who really know what it's like and what is needed for their patients. They're not listening to it. They're not listening.
As a clinician, how does it feel when you want to treat somebody and you're not able to because the system isn't allowing you to treat them?
It's brutal. It's overwhelming. I work hours over each day just to make sure that the patients that I do have are seen or at least heard, or at least I can get an email back to them or a call back to them. I don't get paid for those hours. I don't get any kind of acknowledgement for that hours. And in fact, that is one of the main sticking points in terms of our contract, is how do we provide the care for the patients that we have. We have so many patients on our panels and no ability to close panels, no ability to actually kind of coordinate how we see patients in a way that they can be seen in a really timely manner. So what we're really looking for is more time to be able to see patients, touch patients, be able to get connected with them. The research really supports being able to have, even a little bit of time with their clinicians to then be able to establish treatment of care and then know what needs to be done. We're not able to do any of that. So how I feel, I'm constantly running out. It feels like socks on linoleum floor. I'm always running. I'm getting burned out myself. I've been a psychologist for 24 years. I'm exhausted. Kaiser is exhausting psychologists who care and who want to do this work.
Well, these CEOs who are making millions of dollars and they have $40-50 billion in surplus, why do they care? I mean, it seems like they're not being prosecuted for not providing care. They're getting away with it. And this is, how many strikes have been gone on here? I mean, it seems like there have been a lot of strikes over the same issue.
Over the same issues. We've had a lot of strikes, yeah, because it feels like we have to go to this extreme level to be able to be heard, to be able to make some noise so that, you know, the public makes more statements to make grievances so that, federal and state, law.
There's a requirement that they're supposed to get treatment.
Yes.
Mental health care is supposed to be the same as physical health care.
Yes.
You go to the hospital, you get treatment.
Parity. We're not getting that. We're not getting that at all. There seems to be this real miss between mental health and the medical world. And the thing is that if we have good mental health, the medical costs absolutely go down. If we know we're being cared for emotionally, and that we're able to support patients and patients' depression, anxiety, all trauma experiences, if they can be addressed, they're going to be more compliant, more engaged with their medical care. It goes together. It doesn't work when you just separate the body from the mind. It just doesn't work.
You think that Kaiser calls itself a nonprofit, as does Sutter and these other companies. It sounds like somebody's profiteering.
Yeah, I can't speak to that so much because I'm so much boots on the ground. I just want to provide good care to their patients, to my patients.
You think that there should be prosecution by Attorney General Bonta of Kaiser for not carrying out the contracts? I mean, there seems to be flagrantly violating the contract to take care of people with mental health problems at Kaiser.
Well, I think there needs to be some real extreme action that's taken, yes. Yeah, I think that only that perhaps is what's going to be heard and seen.
If the executives think they're going to go to jail, they might make sure that you're able to treat your patients properly.
It looks like the fines don't matter. And
they've been fined, millions of dollars?
Millions. And it seems as though it doesn't matter. And so, maybe more bite, maybe something more of like if they felt that, they are at risk of jail time because they're not providing the services, maybe that is a very viable option. I think it's at that point. Again, patients are wanting to suicide. Patients are suiciding, waiting for care.
We are striking to put pressure on Kaiser to make systemic change to improve the patient care in our behavioral health centers.
What kind of work do you do?
I'm a licensed clinical psychologist and I work with children and families.
This has been going on a long time. There haven't been appointments. People have been suffering. Why is it continuing like this?
Because Kaiser refuses to make real change. They want the status quo. They want things to continue as they are as more and more therapists leave and put more and more pressure on the shoulders of the remaining therapists.
And the people who need this care, are they being shortchanged? Isn't they promise that they're going to provide the care? Isn't that their legal responsibility?
Absolutely, they're being shortchanged. It's harmful to not be able to get the care that you need.
And there have been suicides. People have really suffered.
People are suffering, and so are the therapists. It's all of us together. We know what is right, and Kaiser needs to step up to the plate and make the change that they're capable of doing. They have the financial and organizational resources to be the leader in the field.
How much money? They have a lot of money in surplus of $50 billion or something?
Something like that.
So much money.
I couldn't even understand it.
My name's Barry Camille. I'm a psychologist. I've been working at Richmond Kaiser for 41 years.
And you're out here today in San Francisco at Kaiser. What are your issues today?
So here are the main issues, and there are really three main issues. One is we can't see our patients with enough regularity to help them in any way. They can sometimes wait 2 or 3 months between appointments, and that's not going to make any kind of therapeutic work happen, actually. So issue number 2 is we need more clinicians so that we can handle the influx of people needing mental and behavioral health care during COVID And Kaiser is hiring more clinicians. The stats we're looking at is they've hired somewhere between 200 and 300 clinicians over the past year, but we're losing clinicians at a faster rate.
Why is that?
It's because our working conditions are untenable, and that's going to be point 3 that I'm going to get to in a moment. So we've lost like 377 clinicians over the past year. So we can't retain them. And the reason we can't retain them is we are so jam-packed with patients, and we are given so little time and support in treating them and taking care of them that I've been here 41 years. I'll stick around for another few years. There are new people coming into our programs and into our psych departments. They can't handle the load. We're not getting the support. So our contract bargaining team has been meeting with Kaiser's management's bargaining team for over a year, and we've been trying to make this clear to them. I've been in on bargaining sessions because in our union anyone can sit in. I'm a union member. I've been sitting in on half a dozen of those for the last month or two, and I can tell you, management isn't hearing us. And ironically, our patients hear us. California State Senate hears us. We had a hearing last Wednesday, and Scott Wiener is making very clear what our needs are. The head of the Department of Managed Healthcare gets it, but the one group that we need to get it that's not getting it is Kaiser Management. They made $8.1 billion in profits last year, and they're still continuing this policy of artificial scarcity, not making our working conditions reasonable enough with enough time to make all the phone calls, secure messages with our patients and our colleagues to be able to have a manageable work environment for us. So our manageable work environment and a good treatment environment for our patients, they're intimately connected. But Kaiser management just won't hear it. And they finally gave us an ultimatum at our last bargaining session on Saturday. They mildly improved the financial, but they didn't really honor what we need to make our work life sustainable to retain clinicians. They gave us an ultimatum that if we didn't accept it and send it to our membership with a recommendation to vote it up by Sunday morning at 10, they were going to withdraw their offer. We couldn't in good conscience. We could have sent it to our membership for an up or down vote. We couldn't endorse it. Our bargaining team could not endorse it because it's very inadequate. So that's why we're out here. It's the only message the Kaiser management seems to hear is in the court of public opinion and in our state legislature and the Department of Managed Healthcare.
Well, they're legally required to provide this mental health care. That's the contract that they have with the members. There are millions of members in California that say that they will provide mental health care. You're saying they're really not doing it, and so people really can't get the kind of care that they need.
Exactly. And we've been look, I've been here 41 years. We've been talking to Kaiser Management about it throughout my whole career, and they really don't care. It's amazing. The upper executives, they get great salaries.
What are they making? Hundreds of thousands?
Hundreds of thousands of dollars. You know, the top execs make millions of dollars, and they have huge, 5 or 6 pensions when they retire. But they create this artificial scarcity for us. Yes, it's part of the polarization of wealth. And so they haven't been hearing us. They haven't improved the situation. So they are legally required to provide care even when we're on strike. And we were hoping they would hear that last Wednesday from the California State Legislature. They get it, but they still don't care. We're trying to make them care.
And how does that affect the patients when they don't get the care?
It's devastating for our patients. I know many patients who are very upset. They're angry, they're tearful. All my colleagues can tell you about that when they hear that I gotta wait like 2 or 3 months for the next appointment. Or me in the alcohol and drug program, we're under-treating them. We see them for maybe 2 months. Before the COVID pandemic hit, I had a continuing recovery group. We could see them for 2 or 3 years on a weekly basis to really see them through the whole process of recovery. And now what we're getting instead is we're under-treating them, and we have a very high recidivist rate. I'm seeing patients come back to our program after they finished it in a month or two, coming back for another round of treatment. They're trying to create more adequate care by coming back, but that's not ethical, professional healthcare delivery.
And if they're not doing what they promise in their contracts, why aren't they being prosecuted by the State Attorney General, Rob Bonta, for fraud? Isn't that fraud? Because they promise they'll give you the care and you don't get it?
We're getting there. We're getting there. Our union has been very active in trying to make it clear to Kaiser's executives. We've been reaching out to our representatives all the way up to the governor of the state.
What about the Attorney General? He could prosecute them for fraud, couldn't he?
That's a great idea. I'll mention that to our union leadership. Hey, look, I'm a psychologist. I don't think that way, but you know what? Great idea. I'll mention that to our union leadership.
And there are millions of workers, union workers in California, who are covered by Kaiser. What do you think they can do to support your fight for care for them and proper care and proper treatment of the mental health workers?
Is to honor our picket lines. If they need urgent care, certainly to seek it, but to honor our picket lines. Already I've heard our engineer sister union, they're not part of the National Union of Healthcare Workers, but they're another union, it's very progressive. They are out on a sympathy strike with us. We deeply appreciate that. And if other union members can talk to the union leadership to go out on a sympathy strike with us, we would deeply appreciate it.
That might end the strike pretty quick.
That might end it pretty quick.
Okay, thank you.
Thanks so much.
Do you have a card?
My name's Daniel.
What kind of work do you do?
I am a psychologist.
Why are you out here today?
To advocate for better access to appointments and to create more space for administrative duties for psychologists and other therapists so that we can provide better care.
And from the report here, a lot of the patients are unhappy. The workers here are unhappy. Why is that? I mean, Kaiser has a lot of money, apparently.
Yeah, I feel like the financial decisions are certainly made a million rungs up the ladder above me, but for the patients I talked to, they complained about not being able to be seen often enough, not having access to therapists, and my colleagues, especially those in the generalist mental health positions, they're just burnt out because they have to see so many patients, and I can speak for myself. There's a lot of booking patients into kind of the ancillary spaces in between appointments, trying to find ways to make everyone feel seen and make sure everything's covered. And our first duty is to be ethical in our provision of care, and sometimes that doesn't always fit into the boxes of our schedules, and we're just trying to make the boxes line up appropriately.
And COVID has added to the mental health crisis. It seems like there should be even better care but it's gone down. Is that what you're saying?
Yeah, well, I think the level of acuity, the severity of our patients' presentations has gone up during COVID. I work in addiction medicine, so a lot of people at home, alone, drinking a lot, getting into drugs, having just a lot of space to decompensate in a lot of ways. So there definitely has been a rise in just not even the number of people seeking mental health, which there has been, but also the severity of what they're coming to us with.
And a lot of your members are stressed out. Their turnover is quite high.
Yes.
How does that affect treatment?
It takes a while to fill positions. Our department traditionally has had very low turnover. We have a very great work culture. I will say the local leadership that we work with in our clinic is really good. But I think a lot of our folks who were maybe within spitting distance of retiring, a lot of complications with working in a COVID environment, a lot of stress of it. A lot of them sped up their timetables and left a little bit early, and those were storied, long-standing therapists with great history department, lots of experience, and it's hard to replace those people. We have lots of fresh faces and young people who want to join the departments, who want to join the field, which is awesome. But sometimes it takes time for them to get used to the work cultures, learn all the workflows, and kind of get up to speed. So there's a challenge there. It's exciting to bring those people on, but it's tough losing folks we've been working with for many, many years.
And is this your first strike?
No. This is my third, I think. Yeah, this is my third. And there was one strike while I was in training as an intern, and I think there have been 3 since I've become licensed.
What does it say about healthcare in California? Kaiser covers millions of people. They have a $50 million, upward $50 million surplus, and you have to go on strike to basically serve your patients.
I would say that, it isn't the priority that it could be. I think we have a lot of opportunities to work together to make things better, and I'm hoping that it becomes more collaborative than it is right now.
You don't think they're collaborating?
It doesn't sound like it anyway. Again, I'm just a guy on the street with a sign. I'm not actually talking with anyone from Big Kaiser, so I can't speak to what's going on in the rooms. But we're out here, so that says something.
I'm Jeremy, and I'm a therapist at Kaiser Walnut Creek, a case manager. I work with really acute patients, so people with suicide risk and severe mental illness. And I'm out here because the patients who I see really needed care, adequate care earlier on, and they shouldn't have had to get this sick to be able to see me in case management. They should have had adequate care earlier on. So
doesn't Kaiser promise that they cover mental health care? as part of their promise?
They do promise that, and and patients all have the right to that. That's the law, right? That Kaiser actually has to provide the care that they say that they are providing, but it's not adequate. The generalist therapists are seeing patients once every 6 to 8 weeks. I can't imagine going to therapy once every 6 weeks. I don't actually go to Kaiser for my mental health. None of us do. We have supplemental benefits for our mental health because we know it's so bad at Kaiser.
If they're not following the law, why aren't they being prosecuted? Isn't that fraud? Promising people something and not getting it? Isn't that a criminal?
Seems like it to me, and I am hopeful that the Department of Managed Healthcare is at least going to be leveraging some kinds of fines, because this is really...
What about the Attorney General? Bonta suing them for fraud.
That sounds great. Go for it.
You think that would be a good thing?
I don't know so much about politics. I'm a therapist, and so that's whatever you can throw at them, go for it, because I agree. I think it's absolutely egregious the way that patients are being treated, and I'm willing to give up my paycheck to make sure that we can fight for this.
There even have been suicides. I mean, people don't get care, they need it, and then they get depressed.
Yeah.
How does that affect you as somebody who works for Kaiser in mental health?
Oh, it's horrifying. I mean, now you'll make me cry if I really get into it. It's not right. It's absolutely not right.
Kaiser has a big surplus, $50 billion or something?
Apparently, yeah. Yeah, it sounds like they at least have enough money to hire a few more therapists and to make it work a little bit better. But they aren't willing to do that, or even to listen to how bad it is.
Thanks.
Yeah, thank you.
So I'm supporting the therapists that are on the line, fighting for better patient access, patient care, quicker turnarounds.
And as a former, they say they're losing a lot of people. People are quitting. Is that?
Yes, the turnover for therapists has accelerated, I think year over year, and increased. I think due to the therapists that are dedicated but simply can't sustain providing the level of care that the Kaiser system enables them to.
That must be frustrating. That's your profession. You want to provide quality care, professional care, yet the system isn't allowing you to?
Yes, therapists are in the profession to support mental health and patient needs, and the Kaiser system is not set up or designed for that to happen in a timely and sensitive and thoughtful way.
Why is that? I mean, this seems like it's been going on for years. I mean, when you were working here, was it the same?
Yeah, I was at Kaiser for 5 years, and I think there were 2 strikes in the 5 years that I was on, so it's a long-term issue, and from longer-term clinicians, we know that it's only worsened over time.
Sounds like it's a system problem.
Yes.
My name is Nadine.
And you're a member here of the union?
Yes, I am.
And what's going on?
Well, I'm here after previous strikes to once again really focus on patient care and having an improved ratio. It's really heartbreaking sometimes to not see people as often as they really need to be seen.
And they also mentioned turnover. There's a very high turnover. It's having a problem really giving treatment.
I've been at Kaiser for less than 4 years, and I'm starting to be one of the senior staff that people go to.
What does that do for care?
What's that?
What does that do for care when you have such a high turnover?
Well, some of the clients I see have had 2 or 3 therapists before me, and each time they go through kind of another loss, and there's kind of a trust issue for some of them, how much to connect before something changes again.
Sounds like a McDonald's. High turnover.
Unfortunately, I mean, there are some staff who stay many years, but yeah, some of them are just, really not up to this kind of situation.
Do you think the members are being shortchanged? I mean, because they're paying for Kaiser.
I do.
So your patients themselves are unhappy with the fact they can't get appointments and that.
Yeah, there are ones that may, of course, not feel that a need to be seen as often, but there are ones that definitely are looking for a more frequent level of support and intervention.
My name is Janine.
You're out here today. What are your concerns today?
Just that patients aren't getting the access that they need. and they need more than every 4 to 6 weeks to see a therapist, so that's the most important for me. That's why I'm here.
And how does that affect the patients when they don't get their appointment? They're in bad shape, they need health care, and they're told that they have to wait?
Yeah, I mean, they're not getting better, right? The idea is to give them the tools that they need to, become stronger and to reduce their anxiety and their depression. But if you don't get the tools because you don't have individual therapy, well, you're never going to get better. And that's the ultimate goal. So that's.
It seems like there have been a bunch of strikes over the same issue. Does that bother you?
It does. Yeah, this is the first strike that I've been part of. I've been with Kaiser for 2 years now. But one of another therapist that started the same time I did only stayed with Kaiser for 3 months for the very same reason.
Burnout.
Yeah. So he only lasted 3 months, and a great therapist. But again, he just didn't feel comfortable, doing what we're doing as far as. Giving the patients the appointment so far out. At that time, it was very bad in 2020. So
it seems like Kaiser has a lot of resources. They have billions of dollars of surplus. Why aren't they making major changes?
That's a great question. I would like to know because on the medical side of things, they seem to be doing fine. My medical doctors are with Kaiser. I'm happy with them, but they don't seem to give the same access or have the same resources on the mental health side of things.
Yeah, I mean, it's supposed to be illegal to treat mental health differently than physical health, isn't it?
Yeah, it is illegal, yet it continues. With Kaiser, it continues. I guess because you mentioned how big of a corporation they are, and so I guess if you make billions of dollars, particularly in the last 2 years, I guess you feel you can get away with that.
They're above the law?
In their minds, it seems that way. So hopefully, this strike, even though we don't want to do it, hopefully this will eliminate them for thinking that way.
Okay, thank you.
Thank you.
Hi, my name's Willow Thorson. I'm an LCSW, and I'm in behavioral medicine in Santa Rosa, and also one of the regional gender therapists. And I first just want to say I've been here 15 years now, and this was the conversation we were having when I started, when the conversation this entire union was founded on. Right? Our white paper. What was it about? Poor patient care and delayed access to care, right? That and poor staffing. That was literally the point of conversation when I started here 15 years ago. It is actually worse than it was, even though we have been naming this relentlessly for that long. And that is unconscionable. That is like this is like blind negligence at this point, right? Like this is just not okay, and I'm so grateful we are here. I do want to say, I came up here mostly just to say a deep and profound thanks to our bargaining committee. We all know how hard it is to manage our caseloads already. They have taken hours and hours and hours out of their schedules to also be doing this and holding Kaiser's feet to the fire and being unrelenting and representing our voices. And that is a whole other layer. I want to say the same to every steward who has helped organize locally in the midst of COVID when we can't even see our members trying to connect. The same to everyone who testified and put themselves out in the public eye, who has stood up and spoken to media, who has taken those risks so that our voices can be represented loud and clear where it matters. So I just want to say that that is extra, right? All of that is volunteer, all of that is service, and they are also living their lives, also seeing their patients just as we are. So I just want to give an extra shout out to those folks and also thank everyone who is here. We need unity and numbers and presence this week, and in whatever time it takes. Things feel different, but it means us continuing to hold Kaiser's feet to the fire and making it count. That's right.
I'm Greg. I was not going to say anything at this rally because everything that people have said is the important. They've already said the important things. when I sit in bargaining with this bargaining committee, what I'm always, and when I see the work that all of you guys do, I am always amazed at how, I don't know how you do it. That's what I say. I don't know how you see these patients day after day after day, back to back to back, without being able to give them the care they need. And I always imagine how soul-crushing that must be.
Hardest part of the job.
And
You got it, Greg.
and so, I think Willow said 15 years, right? It's not quite 15 years, but it's getting there, right? Where we've been NUHW and we did this white paper and Kaiser got fined. And they've been running away from it ever since. And because of all of you and because of all the work all of you have done over the years, making it public, like we're making it public today. It's not just today, it's built and built and built. Now we have laws in place. Now we have, for the first time, we have the DMHC actually doing something. It's significant. It's significant that they put out a press release this morning. It's significant. They have never done anything like this before. And you know what that tells us? The DMHC, the director, reports directly to the governor of this state. Right? And we've been in conversations with the governor of this state. We helped the governor get elected.
That's right.
And so that press release tells us that the governor is listening to us. The other branches of the legislature, you heard Brandy talk about the hearing on last week where Kaiser didn't show up. All the media today and leading up to this strike, media yesterday, was so much on point on our message, and Kaiser's message was a footnote. And everybody who is a citizen of this state knows somebody or is somebody themselves who's tried to get mental health care at Kaiser. So they know who's telling the truth. You know, and if you look at it was the SF Gate article this morning. I haven't had a chance to look at all of them. Actually, SF Gate article was really good because they interviewed patients, 2 patients, saying how bad things are at Kaiser. Kaiser can't hide, and we have a unique opportunity here. Kaiser wants to test us. They don't think you all have the resolve, but you do.
And one more thing, for those of you who don't know, there were full page ads in a lot of major papers that went out today by our union. They're gorgeous. I don't know if Shay is here, but she looks stunning and badass. It's a great ad. On it, there is a post for what patients can do if they are getting canceled and who to contact. And also a little code for anyone to go on and sign a petition supporting us. So what I want to suggest, if you go to, the Press Democrat is one of them, I don't know what all of them were, go there. We should be all blasting that on our social media and asking our people to sign that petition, right? We could do that. We can build a whole other layer of feedback for Kaiser right now just by doing that, and all the infrastructure is there. So I just want to encourage everyone to do that. The more we get that level of messaging and building out, the better. And it's a great way to get the people who want to support us but don't necessarily know how, we give them a specific way to support us.
I take the time and cut them off like these. I don't wanna make the job all easy when you treat her like you're number one.